All right. Good morning, everyone. Welcome to LisaBug Yoga in the month of, where are we? We're September of 2024. And as I'm recovering from 2 hip replacements, we're dialing down the intensity a little bit this month, working mostly on stretching and yin style work, longer held relaxing poses. And today our focus is the spine. So the neck, the upper and mid back, the lower back, and all the ways the spine moves from flexion, extension, side bending, rotation. I also had a special request from Chris Norman for hip flexors, so I'm going to put that in a little bit today too. And it really does go nicely with what we've got on tap today. So I have my yoga block and I also have a little bit of padding for my knees. And we're going to start today down in child's pose. So come on down with me and let's begin there. And I'd like for you to take a wide knee position in child's pose with your big toes touching. Now, if you can't bring your forehead down to the floor, you might put a little pillow or a block under your head. It's not a bad thing if it's floating off the floor, but I just want you to relax your neck. And then I'm extending my arms out long to feel a little stretch through the shoulders and upper back. And just close your eyes and begin to bring your awareness to your breathing. Now, when we're folded in child's pose, it can be harder to breathe into your belly. So I want you to send your breath into the back side of your rib cage, into the area of your kidneys. And let's come into an equal ratio breath. So the duration of the inhalation matches, at least pretty closely, to the duration of the exhalation. And maybe you're counting that breath or just allowing your body to feel that equal ratio. Just check in with your lower back, see how this feels for you today. And my child's pose might look different from yours because with the arthritis I have in my knee and my knee replacement, I'm not able to sit my butt all the way down to the heels, and that's okay. So mine looks a little bit more like puppy pose with the hips up, which is a modification of our downward dog. Let's take one more breath here in child's pose as we ground and center, preparing for our practice today. And then pull yourself up to all fours, hands and knees. And be aware of your wrists. So if you begin to feel a lot of tension in your wrists, you can make fists for wrists and actually come up onto your knuckles, and that will prevent too much flexion of your wrists. Let's take an inhale to prepare, then exhale, tuck the tailbone and round the back into cat, pulling the navel to the spine. Then as you breathe in, reverse that into cow pose. So drop the belly down, lift the tailbone, let your chin slightly rise. And exhale and round up into cat. And again, we'll equal ratio breathe here. Maybe inhaling a count of 3 or 4. And exhaling that same duration, 3 or 4. So as we come into cow, this is spinal extension. And cat is spinal flexion. And just finding a range of motion that's really good for you today, where you don't feel any pain or pinching in your back. nicely mobilizing the spine. Let's do one more of each. Inhaling cow, exhaling cat, and then find a little neutral spine. Neutral with your head, mid back, lower back. Brace your abs and send your right leg back behind you. And then your left arm reaches out forward. This is our bird dog, spinal balance. Excuse me. Now try to make sure your hips are level. The core is really bracing here. Breathing equal ratio, one more breath. And lower the hand and lower the knee. Extend the left leg straight back. Flex the ankle, reach out toward the heel. Right arm reaches forward and your thumb rotates up like you're shaking someone's hand. Make sure the back isn't sagging. The head isn't drooping. Feel power and strength through your spine. One more breath. And the hand finds the earth, the knee does as well. And we'll send that right leg back again. Inhale slightly, lift the leg up, take your gaze forward, a little baby back bend. Then exhale, pull the knee toward the chest and curve the back up toward the sky in your cat. Extend the leg out, lengthen. And draw the knee towards the chest, firing the core. Now we can continue with both hands on the mat, or we can take that left arm away. Inhale. Exhale, bring the knee toward the elbow. Let's do 3 more repetitions. Two more. Last one. Really scoop the abs up as you tuck the knee in. Then reach out away and hold. And set the hand and knee down to the mat. Send your left leg back. Inhale. Little bit of a back bend, then exhale. Curve the spine. Feel your abdominals engage. Equal ratio. Breathe in. And breathe out. Option to add the right arm. Reach and lengthen. Then pull the elbow toward the knee. At your own pace, 3 more repetitions. And when you extend that leg back behind you, engage your glute muscle. Feel your hip flexor slightly releasing. One more time. Breathe in. Breathe out. Then lengthen out, hold, bird dog, and back to hands and knees. Now, at any time, if you need child's pose or even coming down to your elbows, I want you to feel free to do that. Take breaks for your wrists. Okay, we'll send the right leg back behind us again. Flex the foot, you're pointing it down to the floor. Look over your right shoulder and bring that right leg out to the side into abduction. So I'm looking for the foot, shortening the right side of my waist. Then I'm going to pull that leg behind the other one. Look over the left shoulder. shortening the left side waist. We will take the inhale as we go to the right with the leg, and the exhale as we move it across to the left. Equal ratio. Try to match your timing with both movements and allow it to really flow. So the spine is laterally flexing. It's a side bend from side to side. The cervical spine, or the neck, is in rotation. So I want you to look as far as you can to the right side and look as far as you can to the left. Let's take 2 more repetitions. Also firing the right glute, feeling a little bit of lengthening in your right hip flexor. Last one here. Then bring that leg back to neutral. Set the knee down to the mat. Take a break for your wrists, either down to your elbows or a child's pose. You can do a little bit of wrist circling or flexing the wrists. Another option is if you have hand weights close by, is you can actually place the weights on the floor and you can grip them and hold on to them, and that's going to keep your wrist straight as well. Okay, let's try the other side. So we'll lengthen the left leg straight back, flex the ankle, start to bring it out to the left side, turn your head, look toward the foot, then drag it across to the right with the strength of your inner thigh. Look over that shoulder. Inhaling to the left. Exhaling across to the right. Now I have a little bit of bend in the elbows. If we have our arms too locked out and rigid, then sometimes it sends a lot of stress up into the shoulders and the neck. Pull your abdominals in and up so the back doesn't sag. Breathing. Good, 2 more. Range of motion is up to you. Mine is kind of small with the hips as I'm starting to build that range of motion out and in. And bring that leg back to the midline. Set the knee down. Take a break for your wrists. Just check in. Now see how the hips are feeling, the side waist, the hip flexors. And then we'll start to add rotation of the spine for our thread the needle. Back to all fours, hands and knees. I'm a creature of habit and I typically start with the right side. So let's change that up. We're going to go the left side first. So let's start to lift the left arm any amount. And I'm just going to pull the elbow up and then slide it through looking to the right. You can lay that shoulder all the way down or maybe hover it off the floor. Inhaling to the left, equal ratio breathing. Exhale to thread that needle. Now you're using the right arm to press yourself up and to lower your body down. So you're getting some strengthening of your right tricep and shoulder. And let's take one more and then hold that thread the needle. Now again, you might need a prop underneath your head if you can't come all the way down. I'd like you to relax here as much as possible. And then take your right hand and either bring it to set it on top of your pelvis, or you can turn your palm to the ceiling and reach that arm around your body. So you're trying to feed your fingers into the hip crease on the left leg. Take about 5 equal ratio breaths here. Our goal is to have the same weight distribution between both legs, so we're not leaning over to one side. So try to even that out. Relax your jaw, softening the muscles of your neck. Then carefully slide that hand back around to place the palm underneath your shoulder to the mat. Take a nice big inhale, reaching up. And just place the hand to the mat. Now, reaching up with the arm fully straight might not be good for your shoulders. So I want you to be able to control this range of motion any amount as we inhale to the right side, exhale to the left. We did about 5 repetitions on the other side. So let's move through a nice range of motion with that equal ratio breath. Just noticing any differences you might feel from the right to left side, just to be aware, not to be judgmental or down on yourself if you're not able to do it as well on one side as you can on the other. One more repetition. And then let's relax into that stretch as best as we can on this side. Possibly taking the left hand to the top of the sacrum or turning the palm up to the ceiling, wrapping the arm around our body, trying to maybe feed the fingertips into the hip crease. And just check in. What are you feeling? So I'm noticing a nice gentle stretch through my right shoulder. The neck feels pretty good here, a gentle stretch there as well. Feeling a deeper stretch through my right arm as I'm reaching behind the back, but it still feels comfortable. And let's breathe into the side body. Okay, let's very gently slide that arm back around so as not to tweak the shoulder at all. Press the palm into the mat. Full breath in, reaching up. And back to hands and knees. Let's do one more cow pose. Drop the belly down, lift the tailbone, glide the chest forward. Inhale. And one more cat. And back to your neutral spine. Let's transition to a seated position. And we'll have the legs extended forward. Knees can be bent, nice long spine. Feet may be flexed. Activate your legs. Drop your shoulders down, pull them back slightly. And then we'll keep that right leg straight. We'll bend the left knee, just tuck it in here a bit. And then separate your foot away from the inside of the knee, maybe about a fist distance. If I take my fist and put it down through that spot, I've got about a fist distance. And then we'll start to turn and twist toward this right leg. So try not to let it fall out, but use the muscle of your inner thigh to pull it in. You can grab it with your hand, lengthen your spine up, left arm goes behind your body, and look over the left shoulder. Coming back to that equal ratio breath, each time you breathe in, I want you to extend the spine long. And each time you breathe out, just try to find a tiny bit more range of motion, either through the neck, through the upper or mid back. We're not really twisting much into the lower back. It doesn't have a lot of range of motion to twist, and we really don't want to twist in our lower back. That area is responsible for stabilizing our spine, so the mobility of it is very small in rotation. Okay, let's counter this rotation. So we'll come out of it slowly, bringing this other arm across to the side, reaching the right hand behind. We inhale, lift, we exhale and turn. And again, try not to let this knee fall open. You're actively pulling it in. You're pressing down into the ball mound of this left big toe and the center of the heel. How far can you look over that shoulder? Just a couple more breaths here. And coming back to the midline, slide this leg back out to straight. Check in. Sometimes we rush to get to the other side. We just have to take a moment and just feel and notice the sensations in our body. Takes a few breaths to kind of allow that to dissipate and equalize, and then we can come to the other side, bending the knee about a fist distance. This allows our legs to be hips distance apart, not too close together. Then we'll reach the right hand behind our body. We can grab the knee here. We can bring our elbow across. We could also press the palms into a prayer position. So a lot of nice options here with this twist. Try not to let the knee fall open. So we're actively using the inner thigh. Also, this left leg is active. So pull your toes up, fire the muscle of your quadricep. And come back to that equal ratio breath. And as you inhale, lift upward, creating a longer spine. And as you exhale, maybe you can find a little bit more range. But always being gentle when we rotate our spine. We never want to crank it or force a range of motion that doesn't feel good. Should feel really nice. All right, let's come into our counter twist, the opposite direction. When we turn this way, away from the bent knee, this is an open twist. So we might feel like we can go a little further than we went to the right. That's a closed twist. Keep hugging that knee in towards you. Push down into the ball mound of your big toe and the center of your heel. And let's come back to the midline. Allow that leg to straighten. Take a moment to check in. Does your spine maybe feel a little longer, a little bit more free? And then we'll separate our legs a comfortable distance apart into a wide leg seated position. Now, if your hamstrings are really tight, I want to give you the option to maybe sit in butterfly instead. That's fine. So either butterfly or straight legs, soft bend in the knees. We're going to move through a continuous flow of side bending and forward flexion of the spine. So we'll come over to the right side and come up. Come to the center and up, and to the left side, up, and to the center. So on your own, we're not holding any of these. We're just moving in and out through a comfortable range of motion. Notice your sitting bones, and I want you to cement them into the floor. So in other words, when we come to the side, we're not leaning over and lifting our glute up off the mat. We're really stabilizing the pelvis. And we're not looking at finding our edge. You know, we've heard that term before. When we take it to our maximum stretch, maybe about 75% of your maximum. And I'm inhaling during the reach and then exhaling during the forward stretch. Let's get one more sequence to each side. Let's come to center and just relax, shoulders are back. And then let's bend the knees. We'll set our feet on the floor, but keep the legs pretty wide, a little wider than hips distance apart. Hands can be on the floor slightly behind you, and we're going to do a little windshield wiper for our knees. So both legs go over to one side, both knees, and then to the other. And my movement's going to be really small for a couple reasons. Because I'm rolling over onto an incision, as well as this mobility is not quite there yet with this movement of my hips. But you can take it a lot further than what I'm demonstrating. So this is giving us just a little bit of a twist, a little bit of movement through our hip flexors. Let's take one more on each side, and then we're going to bring this same movement down to the mat. Good. So now that you've seen it sitting, we're going to do it supine. So come down onto your back, take your time to get there, pick any props that you need. And I'd also like you to have your yoga block close by so you can reach it, so it's not out of reach once you get down onto your back. All right, so widen those feet, widen the knees. Brace your elbows on the mat just a little bit so your shoulders don't move, and let's start to drop the knees from one side to the other. So now as we do this from a supine position, we're going to feel a little bit more stretch through the hip flexors as we take this side to side. And then I want you to find the muscles in your glutes to activate them as we do this movement. So as you drop your knees to the left, I want you to engage your right glute muscle. You're just tensing it. And as you drop your knees to the left, or sorry, the right, you're engaging the left glute. And these feel very different for me because my hip replacements are 6 weeks apart. So it's a lot different when I go to the right than when I go to the left. So we're going to be holding this. And I want to stretch the right hip flexor first. So the next time your knees come to the left side, we're going to stay there. Now you can stay there without any props to support your legs, or you can take that yoga block if you'd like to support it underneath the left leg and just relax it there. So we're lengthening through that right hip flexor. And another option to deepen this is we can actually take the left heel and place it up on the right outside of the thigh and weight that leg to press down a little more. So I'm not going to do that today, but I wanted to show you the option. And then let's turn our head the opposite direction from where our knees are. So lift your head up a little bit, turn it all the way to the right, and then set it back down. Then close your eyes. Let's take about 5 equal ratio breaths. And as you're breathing, just notice, is there anywhere in your body that you're tensing up or gripping, that you're not relaxing? And just soften any tense muscles. And then we'll come out of the neck twist first. So bring your head back to neutral. Then just bring both legs back up. You still have your knees and your feet wide. Check to make sure your spine is neutral, that you don't have any twisting. You might have to pick things up and kind of settle in on the mat again. And then we'll drop both knees over to the right side. And we can take that prop and support here. Make sure your left shoulder blade is still on the mat. And we're lengthening and opening up the left hip flexor. We can also take this right leg, bring the ankle over the thigh, and load it and stretch down a little deeper. Then we'll pick up our head, turn it as far to the left as we can, and about 5 slow equal ratio breaths. And your arms can be any way you'd like. Maybe you're just opening them way out like a T, or you could reach them above the head and stretch. I'm just kind of folding them across my abdomen and softening the arms and resting. This should feel very restorative. When you get those 5 slow breaths, bring your head back to neutral and pick up those knees, bring them back to neutral as well. And then walk your feet in a little bit closer, having your block available for an optional supported bridge. We're going to push into the feet to lift the hips up off the mat and slide our block underneath the hips, the sacrum. And then just relax the hips onto that prop. And then we're going to take the right leg and slide the heel out long on the mat. So for most of you, this might not feel that intense, but let me tell you, after hip replacement, ooh, this is a big stretch for me. So if you want to make it even more intense, what we can do, slide that leg back in, bring your left knee up and hold on to the thigh, and now try sliding the right leg out. So this is going to tip the pelvis a little bit and make this more lengthening on the right hip flexor. That feels a bit too much for me. So I'm going to set that foot back down. And just allow your right leg to really feel heavy and breathe. So this is also a gentle spinal extension. It's a little bit of a back bend. Make sure that feels okay for you. This can also be done flat on the floor without the block. And in that case, you probably definitely want to hug the left knee in toward your chest to find a stretch. All right, let's drag that right leg in, setting both feet down onto the mat, just pausing for a moment. And my body just wanted to take a really big breath in and just let it all the way out. So let's try gliding that left heel out. This is my newer hip. Ooh, I'm going to be able to go a little bit, but not very far. You can also hug your right knee into your chest. I'm just going to find a gentle, gentle stretch. Still a lot of healing going on there on that side. And sometimes as we find our stretch, after a couple of breaths, we might be able to find a little deeper position. Equal ratio breathing. Let's take maybe about 3 more breaths. And we'll slide that left foot back in. If you've got hold of the right knee, set that right foot down as well. And then we're just going to try to come up and down off the block a few times. So we'll push down into the feet, lift the hips up, and then set the hips back down on the block. If you're not using the block, come all the way to the floor. And we'll lift up, squeeze the glutes, and set the hips back down. 3 more repetitions. Two more. Make sure your knees and your hips and your feet are in the same plane of motion. 2 more. Exhale, lifting up. Inhaling, relax. 1 more bridge. Activate the glutes, lift, slide the block out from underneath, and then slowly roll down. Just relax there, check in. And then we're going to take our time to roll over onto the front side of our body, onto the belly. I'm going to need more time than you, I'm sure. All right, so I've got my blanket here so I can set my forehead down so my neck can be level. If you don't have something to put under your forehead, you can make a pillow with your hands by crossing the top of the hands on each other and just setting the forehead right down onto your hands. So nice relaxed position here. Elbows are next to the body, slightly lower than the shoulders. And then on an inhale, we'll come up into a little baby cobra. So you can keep your hands on the mat, but try not to press down with your arms too much and lift the spine up. Then come back down, relaxing the head. Now, when we come into cobra, sometimes there's a tendency as we lift up to try to lift our head up because it makes it feel like we're going farther. But that pinches the back of your neck. So I want you to still keep your chin tucked in, lifting with the spine, not with the head, and then lowering down. Now check in to see what your legs are doing. I want you to lengthen them long, push the top of your feet down into the floor, slightly squeeze your butt muscles as you lift, and then lower. And there's no real goal of how high to come up. This is about strengthening your back as we come into spinal extension without feeling any stress or strain in the spine or the low back. Now there's a yin pose called Sphinx. So if you'd like to try that, we're going to slide the elbows underneath our body a little bit. And as we come up, we're just going to rest on our forearms here. And this is a huge stretch for my left hip flexor. Whoa. So if it's too much for your back, what you do is you slide your elbows back a little bit toward your feet. You come down slightly. Or you can continue up and down with your baby cobra. Then we'll add some rotation of the head, either in cobra as you come up and down or in sphinx. So we'll just turn our head to the right, to the center, and to the left. Now, can you engage your glute muscles and try to push the front of your hips down into the floor a little more? And then we'll bring our head back to neutral. Glide the elbows back a little bit and relax your forehead back to the mat or to your prop or to your hands. Then we'll bring our arms next to the sides of our body and allow your toes to kind of turn in a little bit. This is reverse Shavasana. So it's exactly the opposite of when we're laying on our back. For Shavasana, we usually have our toes turned out rather than in, and we have our palms facing the other direction when we're in Shavasana. Now, if you'd like a nice stretch for your neck here, we can pick the head up, turn the head as far to the right as we can, and then set it down. Now let your shoulders roll forward into the mat. And one more option for you is to bend your right knee any amount, tighten your right glute, and push the front of your hip down into the floor. If you have the capability of grabbing your right ankle, you can pull it in toward you. or just stay there with a bent knee. Two more breaths. Then we'll straighten the leg back out first. We'll slightly lift the head up to bring it to the midline. Now, if your back is bothering you and you need to take a counter stretch, you can press yourself up to child's pose or maybe a cat stretch at any time. If you're doing okay, let's lift our head up and turn it all the way to the left. Relax our head in this position and let your shoulders melt forward. Let your heels roll out a little bit. Reverse Shavasana. We can try bending that left knee. And then tighten this left glute. Try to push your hip down into the floor. We're releasing the hip flexor. You can also grab that foot, pull it in. You could even use your yoga strap to do that if you really wanted to. I'm just going to hold the bent knee. And let's breathe. Allow your arms to feel heavy. Let the earth hold you up, not your body. And then we'll straighten out the leg first. Lift the head up, bring it back to the neutral. Glide the hands underneath the shoulders. Now I'm going to give you the option to press yourself up and back to child's pose, or maybe to a downward dog. I'm just going to see what my body can do here. My knees don't really want to take any pressure, so I'm going to try a down dog. So I'm going to tuck my toes and push up and lift the hips. Oh, that feels pretty nice. I know it's not a great down dog, but it just feels really nice. Ooh, okay. Either one of those two poses or anything else that you'd like. And then from here, a forward fold is our next destination. So you can either walk your feet toward your hands or your hands to your feet or a little bit of both. And then once we're there, bend your knees any amount you need to. And let's come into ragdoll. So we're going to reach opposite elbows and hang down. So this is our forward flexion, and we probably feel it a lot in the back of the legs, maybe in the lower back too, all along that posterior chain. Breathing into the back body. And sometimes in a ragdoll, we kind of move our body from side to side a little bit with gentle rotation. Lateral flexion of the spine. Equal distribution of weight into both feet, right and left. And then back to the midline. Release the hands from the elbows and start to stack the spine. Tucking the tailbone will begin to round the back and roll up to a stand. Head comes up last as that last piece of the spine stacks and lengthens. Then shrug your shoulders up toward your ears just a little bit, squeeze them back, and then drop them down. So we're nice and tall here through the upper back. I'm just going to turn to face the camera here. You can as well if you'd like. And we'll just tip the right ear toward the right shoulder, lengthening the side of the neck. And left ear, left shoulder. Just one more each side. Back to center. Hands can go to your shoulders or maybe behind your head, opening up your elbows will side bend to the right. And to the left. One more each side. Hands can stay here, or maybe we reach up. Side bend right and turn a little bit toward the ceiling, dropping your left shoulder back. And then up. Other side. So it's a little bit of a rotation here in our side bend. And one more each side. And soften the knees, separate the hands. We'll come down into forward fold, a nice swan dive. Then inhale, reverse swan dive, come up. 2 more repetitions. Finishing with one more in-breath, reach, allow the palms of the hands to connect. Pull the thumbs into heart center. As we close our practice, this is our Anjali Mudra, and a mudra means a sign or a symbol. This is our symbol of gratitude and honor. I am so grateful and honored to be able to present this practice for you today from the comfort of your own home. And the light and the joy that reside within my heart honor the light and joy in the hearts of each of you. Namaste. Thank you so much, everyone, for joining me. If you have to scoot, send me a little message. Let me know how you felt today. Or let's have a little chit chat and a little bit of a debriefing to let me know how you feel. All right. Let's see. Do I have a message from somebody?